The United States has been categorized as an aging country. For the first time in U.S. history, it is estimated that the proportion of older adults will outnumber children by the year 2034. Due to this increase in the older adult population, there is also an increasing demand for services specialized to their needs. With the aging process, there comes many changes both physically and mentally due to the idealization of youthfulness tied to the beauty. The aging process is looked at with fear. Aging comes with limited activities, limited mobility, which then passes into the loss of physical fitness and increased social isolation, which all contribute to increased risk of mental health issues. On an individual level, older adults can experience physical limitations, falls, and safety issues. Chronic diseases and acute illnesses can also lead to frequent hospitalizations, as well as financial challenges that can affect their home management. On a family and community level, older adults can have a majority of their support from their direct families, such as their siblings, children, and grandchildren. However, not every older adult has an immediate family they can rely on. This then leads to a lack of social network/social support, leading to isolation and caregiver issues that can lead to elder abuse. At systems level, as one ages, there is a great resource disparity for those who do not have reliable transportation or who cannot leave their home. They face limited transportation. Getting to and from places is a big challenge. Some older adults may be bedbound, creating an even bigger boundary to resources like senior centers, social services offices. Loneliness, including feeling a lack of compassion or feeling socially isolated, has major implications for the health of older adults. 1 in 3 respondents reported feeling a lack of companionship, and living alone in particular was highly associated with feeling lonely. 20% of suicides per year are from people 65 plus. About 1 in 15 people suffer from depression. Only 10% of those 65 and older get help for depression. Family history of major depression, fear of death, socially isolated or living alone, other illnesses, chronic or severe pain are all risk factors. Latinos are the largest and fastest growing ethnic group in the U.S. and comprise 17% of the population. The Hispanic monolingual population are seen to have higher rates of depression, predominantly immigrants and those with lower English proficiency, reporting severe depressive symptoms. Depressive symptoms include persistent sadness, feeling lethargic or slowed down, constant worry over money or health, crying spells, feelings of worthlessness or helplessness, weight changing, pacing, and fidgeting, as well as problems sleeping. The effects that stigma have on people with mental illnesses and their families are extensive. With stigma comes a lack of understanding of important others, which can be invalidating and painful. This can lead to isolation and shame. Perceived stigma leads to an internalized shame about having a mental illness. Besides physical limitations, it is also known that older adults deal with many different medical conditions that occur during late life. Depression often accompanies medical conditions such as hypertension, heart disease, diabetes, chronic lung disease, arthritis, and cancer. In order to effectively treat both chronic health conditions and depressive symptoms, it is crucial to integrate the care of both, as the previous evidence suggests. Older adults are more likely to put the needs of their medical condition before their mental health, warranting frequent visits with their general physicians. The paradox with this is that although physicians may be more aware of depression in the context of medical comorbidity, recognition does not necessarily mean attention to treating depression. Aging is a fact of life, and it affects all families. As adult children, when imagining our parents as seniors, we may not fully comprehend the extent to which their aging will affect them or how it will affect us. However, the time does come when effects of aging become more evident and long-term care may be needed. As children and older adults, it is important to ask, are they living alone? Do they live close to you or with supportive relatives? How are they managing their finances? Do they need assistance? These are all very important things to consider and discuss seriously with your elderly parents. Easy and affordable self-care tips for older adults include enjoying their favorite hobbies. What do they love to do? Reading, playing golf, or crafts. Make sure they are setting aside time every week to enjoy them without interruptions. Rest and recovery is also essential for seniors. Getting a sufficient amount of sleep is essential for preventing depression. Pet owners said that their pets help them enjoy life, make them feel loved, reduce stress, provide a sense of purpose, and help them stick to a routine. Respondents report that their pets connect them with other people, help them be physically active, and help them cope with physical and emotional symptoms, including taking their mind off pain. Older adults can find resources specialized for them at social service agencies, community mental health centers, senior centers, Meals on Wheels programs, in-home supportive services, community centers, as well as through Medi-Cal and Medicare. While stigma continues to exist, it can be eventually eliminated with greater education and awareness about mental illness. It is important to educate people around you about the reality that mental illness is more common than people realize, and speak out against stigma. Talk to the older adults in your family today if you detect any mental illnesses. Efforts to address depression among the elderly can begin with an awareness that loneliness is connected to both physical and mental health. Family, friends, neighbors, and healthcare professionals can help to identify older adults who are experiencing loneliness or may be at risk. Encouraging and supporting meaningful social connections and more frequent interactions is important. The proportion of older adults in this country is becoming larger. The older adult population is full of potential, and we all must do everything we can to take advantage of this opportunity. Check in on the older adults in your family and community. Prevention and early intervention is the key to addressing older adult mental health. Thank you.